Everybody's very proud of the hard work and putting that video together. I'll introduce the two gentlemen that are coming up on stage in a moment, but I just want to thank everybody for the opportunity and privilege of your time, an opportunity to highlight and showcase as well as update you on our progress as it relates to vaccination rates here in the state of California. As of this morning, we have recorded over 38.6 million doses of vaccinations that have been administered in the state of California. We have joined 11 other states. There's just 12 states in the United States that have vaccinated over 70% of their adult population. As you all know well, President Biden established that goal for July 4th. We were able to achieve that goal 1 month earlier. And put it in perspective, the state of California, 40 million strong. You add the populations of those 11 other states, it's roughly equivalent, a little bit over, but roughly equivalent to all the population of those states combined. And so it puts in perspective the magnitude of the efforts here in the state of California and the magnitude of some of the success. But we are mindful good enough never is, and we've got a lot of work to do, and that's really the spirit that brings us here today, and the spirit of the hard work that's being done every single day all throughout the state of California to get out on the streets, boots on the ground, and knock on doors and reach people where they are and do more to promote and celebrate the progress, but promote the opportunity to continue to advance that progress here in the state of California to increase our vaccination rates on our way to this June 15th date where we will move beyond the blueprint and we will substantially move forward without the modifications, without the conditions and requirements that so many Californians have had to experience over the course of the last year plus. So 70+% of Californians 18 and over, adults, have received at least one dose. We are seeing vaccination rates across the spectrum improve, particularly in Black and brown communities, though we recognize we still have more work to do in that space. And so we're here, again, proud, but also mindful of the work that's in front of us, particularly in this light. And I've said this often, getting from 30 to 40% of people vaccinated, that's an easy 10%. Moving from 70% of adults to 75 and beyond, that's stubborn, that's difficult work. And so over the course of the last number of weeks, not dissimilar to other states across America, we've seen a rate in decline, particularly of first doses. In many respects, the numbers that are reported on a daily basis mask that distinction, first doses versus second doses. So over the course of the last few weeks, as we saw that decline in those first doses, we realized we needed to do a little bit more than just our traditional outreach efforts with community-based organizations, our outreach efforts in language, knocking on doors, phone banking, and all of the pop-up sites and walk-in sites, school-based sites, synagogue-based sites, church-based sites, and partnerships. And that's when we decided to move forward with incentives. This today is among many of the incentive programs the state is advancing. You're seeing local incentives, and I want to applaud the mayors, city council members, city administrators, members of boards of supervisors for their innovation. I want to thank other states and their innovative leaders for coming up with novel strategies, novel approaches. I want to thank the president himself for his support of incentives, his making available recently with language that makes available federal funds to help support efforts like those that we're announcing here today to incentivize and to encourage. I know some are cynical about these things. Some are in denial that they should have any, role to play as it relates to doing the right thing, and that is getting a life-saving shot that will not only save or support your own success throughout this pandemic and getting us to the other side, but also supporting the health and safety of your loved ones and broader community and our state and nation. But we are where we are, and incentives have long worked, and incentives are indeed what we are advancing here today. It was, in fact, a week ago, a little over a week ago, on Thursday of last week, that we announced a $116.5 million commitment in our totality of incentives coming from the state specifically. We initiated a program, started last Friday, to encourage people that haven't received a one-dose shot to get that dose at least one dose, in order then to make themselves eligible for the announcement today and the prizes that we'll be announcing next Friday. We encourage people as well to get a vaccine by providing gift cards of a $50 value. We've got over 343,000 people that have received or are about to receive notification that they not only are eligible, but will receive that gift card after their second dose, or more appropriately after that one dose, if indeed they choose the J&J vaccine. It's a digital program primarily, so email and text, but 343,000 people have already availed themselves to those incentives. Those incentives will continue roughly, we hope over the course of the next few weeks. Again, this is all around skating into June 15th. But in addition to those cards, virtual, physical cards that we are providing, those $50 gift cards, we are also announcing these cash incentives. And that's why I'm proud to be here at the headquarters of California Lottery. This is not a lottery-sponsored event, however. Director Johnson, who's here, reminds me of that every hour. His attorneys remind me of that every minute. And we are mindful of the rules and regulations that govern the lottery, but we are also mindful that they're a member of the broader state family, and no one does it better than the California Lottery in terms of how you safely, effectively, and securely do cash incentives and prizes like this. And so we're here with their expertise, borrowing some of their equipment. You see behind me some very novel, more modern equipment you may see, and the equipment behind me, which none of us will ever see because of security, but as well sort of the historic wheel here that is our own, that states are trying to steal all across not only this country but around the world. And you know, we're generous, but not if they don't ask permission in advance to utilize some of what California, especially my age, remembers so well from our youth. But we've got these here just to remind people of where we are, but also remind people of where we need to be as we go together to inspire you if you're on the fence, if you're just a little bit hesitant, or you just were unwilling in the past, but all of a sudden you think, wait a second, I can really use $50,000. We're doing all this to encourage that and to get you to think anew and hopefully act anew and get in, walk into. You don't even have to make reservations most of these sites and just get that vaccine. So if you're not eligible today for this drawing, $50,000, next week you'll be made automatically eligible. And then all of us that have received a vaccine, with exceptions, including myself, I'm not eligible, but for all the others that are eligible, those vaccines and those that have filled out those forms in the registry will have the final big drawing, $1.5 million prizes to 10 individuals on June 15th. But we're here June 4th and next Friday, June 11th, drawing at random from a group of 21.5 million eligible Californians. We are drawing at random 15 numbers, what we call unique numeric numbers, where basically just numbers that have no identifiable person in terms of their name, their information, HIPAA rules, all that's protected, your privacy is protected. So these unique numeric indicators allow us through DPH, which is Department of Public Health, to send those unique numeric indicators to the lottery, and then they're able to translate them into the numbers and the balls that you see behind me. So we went from 21.5 million eligible folks today down to 200, and of those 200, there are 50 individual numeric indicators in this machine you see behind me. We will draw 15 today. The remaining 35 will be backup if the first 15 are not eligible based upon a number of criteria, including being a member of the governor's office, a staff member at the lottery, being incarcerated, working for the lottery, more broadly, friends, family. There's some family member criteria that's in there. HHS is not eligible. Members of the Department of Public Health are not eligible as well, but everybody else is. But if we do pull those individuals, then we use the 35 remaining balls as backup and those other 150 remaining balls as tier 2 backup if indeed we get a bad draw. And so that's a complicated way of saying all 21.5 million of you had a chance to win, and maybe you have. And you're going to know in the next couple days. We're not going to announce names today because we respect your privacy, and you have a right to say no. Some people may not believe in receiving government dollars and may not like participating in prizes. That actually happens with the lottery in some cases. And so folks have the right to say no, to remain, remain confidential, remain private. So what we're going to announce today is the numeric winner and the county that the individual is residing in. And for that, we have a remarkable young man who served in the Navy and has been serving on the front lines of this pandemic, Claudio Alvarado at UC Davis. And he's there working pediatric emergency health, the nurse. And we have someone well known. You can't have an immunization discussion in the state of California without bringing your own immunization expert, Dr. Pan, who also happens to be a state senator and also happens to represent this district. So it would not be appropriate to do this without Senator Pan. So he's an expert in pulling numbers in addition to his expertise in immunization. And of course, Audio's only been here a few years. He's from New York, and we'll talk more about that. He's an expert in counties in the state of California. So he'll be pinning the county. He's been, by the way, long story short, he's like, I know most of the counties, but not all the counties. Don't put me on the line, too much pressure. But we're putting him right in front of you, and there's a lot of pressure on Claudio today. And that just is what it is. That's, you didn't have to say yes. So we'll see how, learned he is as he's looking for Plumas or Lassen and Siskiyou and Modoc. But we'll, as he finds those counties on the map, he's going to pin them. And then we're going to start making calls next few days. And when you fill out the registry form, all your information's on there. Some's easier, some is more inclusive than others. And over the next couple days, hopefully the next few hours, we'll get a lot of people, notify them. And then to the extent they want to be made public, we'll look forward to learning more about what motivated them to get the vaccines, et cetera, and encourage others, because this is all about raising awareness, about encouraging others that are on the fence to get vaccinated and continue the good work. So we're not, as I say, over and over and over again, running the 90-yard dash. So we're honored to have the senator here, honored to have a remarkable young man who's been on the front lines of this pandemic, and as you'll learn in a moment, has also been on the front lines, not just here in the state of California, but he, on his own, went to New York and helped support their efforts in early March last year. Didn't need to do that, but wanted to be supportive when they were experiencing their surge. And he was one of those California doctors or nurses that actually went out there to help save lives. So he's got a unique perspective, a unique experience, and we want to highlight a little bit of that as well. We talk about COVID heroes. He's legitimately one of them. And so with no further ado, let's get this show on the road and let's get these names, or at least these numeric identifiers, announced today in the counties, and let's look forward to encouraging others to join this effort. Everybody's automatically eligible once you get one shot or more. 12-year-olds and up, 12 to 17, you're going to get a savings account. We don't want to spend that money at 12 or 13. If you're like my kids, you do Roblox or something, too much video. That's a whole nother conversation. And forgive me the brand there, but that's an issue. But at 18, we'll get you that money. But we want to do college savings, but this is a lot of money. You can do college savings and, have money for your entrepreneurial passions as well. So we want that to be additive. We want a little bit more here in the state of California because we're California. So with that, we'll pull this podium and we'll talk to our extraordinary pediatric emergency nurse. Thanks, guys. Come right back there. Tell me a little bit about it. I mean, I introduced you, but also we're really proud of you, the incredible work you've been doing. You've been at UC Davis for the last, 5-6 years?
About 5 to 6 years, correct. So I'm actually the assistant nurse manager in the emergency department, specifically in the pediatric ER. But simultaneously, I'm a lieutenant commander in the United States Navy Reserves. And COVID first really, truly hit me whenever I got the call to deploy to New York within 24 hours. I was having dinner with my family, get the call on a Saturday, and we had to leave on a Sunday. So we went to New York thinking that we were going to be at the Javits Center in New York, and little did we know that we were actually going to be in the community hospital, and I was stationed at one in Brooklyn. We had a crew there that worked in the emergency department, and I still remember to this day going through the double doors and just seeing the amount of sick people and then seeing the amount of death that was there. It was rampant. I tried to tell this to the crew that we were with, sailors and airmen, and I had to just tell them that we couldn't save everyone, but we can only do our best while we were there, because it was everywhere. 2 months later, after doing my time in New York, come back to California, seeing that we were doing really great care here. We were really well prepared, especially at UC Davis Health. We helped prepare our nurses and our staff to provide great care to our patients. And now we're here, over 150,000 vaccines given at UC Davis Health, and it's a full circle. And I volunteer to give vaccines as well too, and it's kind of that full 180 for me.
Right.
So if you're on the fence about getting a vaccine, please do. Not only can you save lives, but you can also save a lot of money, and you can get a lot of money.
It's interesting. You were one of the first, yourself, to get those vaccines, right? I think you were
Correct.
like number 2.
I was
right?
number 2. I was right behind Eva, who did the whole famous hands up
So you were a little jealous.
I was a little jealous. She stole my move. I actually told her about that move.
Did you? Oh, even worse. Unbelievable.
But I was number 2. I mean, whenever they said that they had the vaccines ready to go for us, there was no doubt. I ran to it. I really wanted to get it. It made me feel safe after I got it, and it also helped me know that I wouldn't be able to give the COVID virus to someone else.
Right.
So that was a big part for me.
So is that, I mean, in terms of your just messaging, and I appreciate it, not only save your own life potentially and keep you healthier, but you talked about even saving money. I mean, the costs of folks being in ICU, hospital, et cetera. But what else would you say to folks that are just, they're like, it looks like the state's making progress. We have the lowest case rates in America, California. We're seeing stability. We have among the highest vaccination rates, not just in the state of California, but just consider 15.4 million vaccine doses have been administered in this state than any other state in the country, one of the highest numbers in the world. People see that and they say, looks like we got this.
Yeah.
Places reopening. What do you say to those folks in terms of your personal experience with this?
COVID is real. It's still here. Being a patient with COVID, especially in the emergency department or even our ICU, family isn't allowed at the bedside. The look on patients' face when they have COVID and they have shortness of breath and they can barely breathe, barely talk, and they have no support other than us, our nurses. We are their family at that time. It's the scariest moment, and I can still remember that face of plenty of patients that have had COVID and are suffering from it. It's real. It's I know seeing is believing, but please believe me when I say that it is true. It is devastating, and this vaccine can save your life.
I love it. Great message, and more importantly, just great example. Thanks for everything you've
course,
done
Governor. Thanks
for
so much
all
for
of
having
us
me.
and all across the country, which is even more extraordinary.
Definitely.
We appreciate that. So with that, you ever seen this thing?
I have not.
You seen it on TV?
I have seen it on TV.
All right.
Yes, I have seen it
on
on TV.
TV. Director Johnson's heart. He wants to know that you're still watching
It's
this
fancier
stuff.
than I thought, actually.
It is a little bit fancier.
Yeah.
Now, I just want to go on record. You have had no access to this device prior.
Negative.
You have no knowledge of the team behind the curtain.
Negative.
All the rules and regulations, the auditors, the security, all of the above.
Correct. Negative.
Right. You're not aware of who's won.
Nope.
You don't know what these numbers even mean.
Nope.
And you're just learning where all the counties are in the state of California.
Exactly.
Right?
Exactly.
All right. I just want to go on record. I just want to make sure we're.
This is what I'm really focused on right here.
Nothing in your pockets, the whole thing.
Nothing,
all right.
correct.
So with that, let's turn this damn thing on and let's get
it.
these. Let's get these 15
Yes.
names, or 50 balls. We're going to get the first 15 names and do the first 5 here in a second. There it drops. Takes about 10 seconds, and then these balls are going to start dropping. There'll be 5, and we'll start to do the numbers. Everything look okay?
It looks great.
All right.
To my eyes. Yes.
To your eyes.
I'm looking.
Everything-
I'm looking.
Right? All right, just seeing. And you haven't seen these numbers before? These surprise you as they
I've seen
surprise
numbers
me.
before, but not these.
Not these. All right, so we got the first 5 numbers. And again, these are unique numeric identifiers that connect to a name, so they're real winners here. $50,000. Each one of these balls represents $50,000 check that individuals receive when they get their second shot. There's always stipulation. We want people to follow through. And so with that, we will start with number 18.
18.
There you are. And we'll find out where number 18 is.
18?
Mendocino
Mendocino
Let's see
County.
how
Woo!
quick you are to find Mendocino County. On
All
the board.
eyes on me. Ha, that's an easy one.
Look at, all right, we got it. Look at that, look at that. You didn't spend that much time in New York. We got number 25.
25.
Where's number 25 from? Here you go. Oh,
Los Angeles.
Los Angeles. You shouldn't have any trouble finding it. Oh, look, we got some LA folks here. I love it.
Ooh.
There you go. Look at that. All right, number 43. Where's 43? Aha, Santa Clara. Look at that. I like the geographic distribution. Got some Santa Clara fans there. Santa Clara University graduate here. So we appreciate that.
Santa Cruz,
Oh,
right
right
there.
up
There you go.
Well done.
A little bit of a tough time.
We got
that
number
one.
3. Number 3. Where's number 3? Oh, look at that. Alameda. You know where Alameda is. All right.
You're putting me on the spot.
No, come on. Just stick in the Bay Area. Right above Santa Clara. Look at that. Look at that. And the first 5, the number 5 goes to number 48. 48 is
San Diego.
San Diego. All right. All right. As our good nurse puts that up, I'm going to invite Dr. Pan, Senator Pan, and he's going to draw the next 5 numbers. Thank you very much, Senator.
Thank you. Well,
All right.
Before we start, I just want to thank the governor again for this wonderful program. I just want to, thank you so much for your service.
Of course.
COVID is obviously very serious. We just heard about it, but hope everyone's having. Oh, thank you. All right. So hope everyone's having fun today. Yeah. All right. All right. Yes. Okay. We call this Vax for the win because actually getting vaccinated is winning. Now, it's a win because we protect ourselves against COVID. We protect our community. But you know what? It doesn't hurt to have a little prize at the end. I'm a pediatrician. And as a pediatrician, I say that you get when you give vaccine, we give a sticker and a lollipop. Don't tell my wife that. He's a dentist. But we should have a little reward and prize for people who do the right thing, protect themselves. And in fact, since we're talking about vaccinations, I'm vaccinated. I'm going to take this off right now. Okay, excellent. So let's go ahead and let's see the next 5 balls here. All right. And I have not seen this machine either before, other than into... Okay. Round and round she goes. Okay, 1. All right, we got 2, 3, 4, and 5. And I have to admit that, since I represent this area, I got to go rah-rah, Sacramento, Yolo County, so we're going to see. Okay. All right. The first number here is number 17.
Ooh, number 17.
17. Los Angeles.
Los Angeles.
All right. Now, I'm paying close attention to statistical odds given the population, whether any county's getting an advantage
that's
here.
the thought process.
Okay. Next one, number 16.
Woo!
San Francisco.
That's right.
All right. The next number 41.
Look at that
Orange County. All right. Oh, this is going to be number 1.
Number 1.
Santa Clara again.
Santa Clara. All right. We got a twofer for Santa Clara now. Okay, they better really be vaccinating over there. there. Okay.
So all this side, we need to go further this way.
Okay. Need more Central Valley here. Okay. 37.
Los Angeles.
Los Angeles.
All right.
All right. Well, congratulations to all the soon-to-be-discovered winners. Again, it's really appreciate, Governor, for your leadership. It is so important we get as many people vaccinated as possible. You know, we're really excited about June 15th. Everyone's excited about June 15th? Yeah. Right. And then I'm looking forward to July 4th. We call it Independence Day. Well, it's a new kind of Independence Day. We can get everyone vaccinated. So for all of you who've gotten vaccinated, this is your little reminder. You can get vaccinated. You're going to vax for the win because you're going to protect yourself, protect your community. And guess what? You might have a chance of winning a great prize. So let's go ahead and make it happen. All right. Thank you.
Well done. Thank you, Doctor. Thank you. All right, let's roll the last 5 and let's get this.
Yes.
Let's get some folks in the Central Valley.
Central Valley.
Yeah. Or wherever chance lays. So we're not influencing anything.
Anywhere.
I mean, we do live in Yolo and Sacramento. We're there as well. All right. Let's challenge Claudio on some of the rural counties.
The northern ones.
Let's see how you do. All right, we'll just jump right in as we're moving this. Number 12. Look at San Diego's doing well. Another one for San Diego. All right. All right, number 39. Oh, San Luis Obispo. Slow. All right, let's see. I want to watch this. I want to see how you do. I mean, there's no pressure. No one's looking at you. We're good. Oh, look at that. It was good. Well done.
That's quick.
I was impressed. Number 45. There you go. San Diego. Look at that. Look at that. Unbelievable. All right, Dr. Penn, with 2 more. Okay. You know, is this guy yellow on it? Sacramento, we're going to find out. Number 6. San Francisco. By the way, I had nothing to do with that one, all right? And the last one this week, $50,000 ball going to whoever of the 21.5 million Californians that just randomly has the number 40. 40. And that person resides in unbelievable Santa Clara. Look at that. So a lot of Bay Area counties, and we got San Diego, LA doing pretty well. What do you take away from that map? What is the first thing that comes to your mind?
I think you chose a lot of West Coasters.
There's a lot of coastal. Interesting. Yeah. But I mean, it does go to the point. I mean, it is an interesting right. I mean, there's the 21.5 million people that did get a first dose of vaccination. So a higher percentage of folks in some of these counties, which has been the case, as you see, some of these counties do have a larger percentage of the population that are getting vaccinated. And it's another reminder of the importance of the work we have to do to address those gaps and to address some of those disparities. It's not just along racial ethnic lines, obviously it's geographic as well. And so want to just encourage everyone, Dr. Pan, you said it beautifully, just encourage everybody that's not in this mix. They can do so next Friday. We're going to do this again, another 15 people, $50,000. We just handed out $750,000. We'll do another $750,000 next Friday, and everybody gets vaccinated is eligible. So with that, I got my spokesperson who's here, and we're here, Dr. Pan, to answer any questions that you may have.
Governor, Sophia Bolag here from the Sacramento Bee. Apologies, first question is not going to be about the lottery. I wanted to ask you, you've taken a number of steps as governor to insulate yourself from conflicts of interest since you took office, including putting your businesses in a blind trust, banning your political advisors from lobbying you, but you haven't taken similar steps when it comes to your wife's nonprofit. As we reported yesterday, her nonprofit has accepted hundreds of thousands of dollars in donations from companies that are lobbying you, and I'm wondering, why haven't you taken steps to insulate yourself from that potential conflict, given that your household income is partly due to her salary from that nonprofit?
I'm incredibly proud of my wife. She's been running a nonprofit for well over a decade, well before my time here in Sacramento, and really proud of the work in particular around gender equality, women and girls. And so her advocacy, her nonprofit, predates all of these efforts, and we should expect, and she certainly adheres, actually going further in terms of disclosures. We expect nothing less. I expect nothing less, and just continue to be incredibly proud of her.
So do you not see any sort of conflict with her nonprofit accepting donations from companies that are lobbying your administration?
Absolutely none whatsoever. There's no correlation, period, full stop. Absolutely none. And in fact, the work she does is inspiring not only here in the region throughout the state, but increasingly around the world. She's done, I think, 3 or 4 documentaries that have had a profound impact in terms of the debate around gender equality, masculinity, and I hope she continues to do that for decades to come. And I don't want my professional work to get in the way of her extraordinary contribution more broadly to society, particularly women and girls.
Governor, this is Adam Beam with the Associated Press. The Cal OSHA board had a pretty confusing meeting last night where they adopted some new regulations about mask wearing in the workplace. Will you use your executive authority to overturn or overrule that decision?
I appreciated the deliberation. The dust is settling. They've got a subcommittee that's going to be meeting to follow up on some of the work. We're pleased that they made progress moving in the right direction. Had they not acted last night, the physical distancing requirements would not have been augmented. They now have, which is encouraging. So they're moving in the right direction. We'll continue to look forward to the deliberations there at the board. It's an independent board. One has to be mindful of that. Same time, I'm mindful of the work that we've done, the progress we've made in this state as it relates to mitigating the spread and transmission rates of this disease. Again, the lowest case rates in America and one of the highest vaccination rates as a percentage of population. More work still to be done in that place. They've got that subcommittee meeting coming up. Look forward to working with employers, labor, and others to see where we land.
Right, but the meeting that they're going to have and any changes they could make to this would probably be August at the earliest. And June 15th is when you want the new rules to go into effect. There could be some conflict there. Would you act before that? Do you see a need to do that?
Look forward to working with employers and labor, continue to work through these issues, and I appreciated the step they made to move in the right direction, closer direction. But look, I'm mindful this disease has not been extinguished, hasn't gone away, and you're in a dense environment, hundreds of other employees, many of them haven't been vaccinated. This disease is not taking the summer months off. We're not there yet. We won't be there. We're mindful of variants. And so we've never said that we were not going to consider some modifications post June 15th. Let me be specific. We've been very forthright in terms of modifications for large indoor settings with a lot of folks from different backgrounds, walks of life, people coming internationally, et cetera, and mindful of the importance of face coverings, non-pharmaceutical interventions, as well as pharmaceutical interventions around vaccines and testing requirements. And so all those things are being adjudicated and considered, and we're working with employer groups, and we're working with employee groups as well, and we're processing this. We want to see what happened last night, just happened last night, and we look forward to updating you more as we make progress towards eventually getting this 100% behind us.
This is Laurel Rosenhall from Cal Matters, following up on a similar line of questioning.
I'm glad there are all the questions about the lottery here, but I appreciate
well, this is about your June 15th reopening, which obviously is part of what the lottery is about.
Good. That's good.
Are you going to make sure that state government follows the same reopening rules as private businesses, or would we might maybe see capacity restrictions at like the DMV or the state capitol or other places while private businesses don't have those capacity restrictions?
No, we're modifying this in a sequential way. You saw 8 additional counties this week on Tuesday that we announced moving into less restrictive tiers. This has been a process of unfolding. It's been a deliberative process based on case rates, based upon science data, epidemiology. It's on the basis of iteration, changing conditions. And so the one thing I'm certain of is there's uncertainty in the future. And as it relates to augmentations, modifications, as it relates to further iterations, that's something we expect and should expect. As it relates to subsequent announcements, we'll continue to be making them. We've made the detailed announcements on the guidelines we set forth for June 15th. We've made those public some time ago. We'll continue to look at them. OSHA's looking at them as it relates to larger employers and other private sector employers. People are coming back with their opinions, their thoughts, public, private employees, state government, local government. We're getting feedback from local health officers. I was with the mayor of San Francisco yesterday with her feedback on specific provisions. And so over the course of the next days and months, we'll unfold with updates, recommendations, less mandates, more encouragement, more incentives, as well as more resources. Mindful just on the OSHA requirements last night around masking, that a lot of employers are not in a position to afford N95 masks. We're looking to augment that. It's among many things that are happening in real time, the deliberation that we're all having in real time. So over the course of the next number of days and weeks, we'll be making more information available, making stronger determinations basis of that communication, and ultimately updating our guidelines accordingly.
So it sounds like some restrictions could still be possible on June 15th.
I wouldn't run, well, some restrictions by definition are.
Capacity restrictions.
Yeah, on the basis of the information that we made public as it relates to guidelines, that's certainly the case. And I remind folks to take a look at the guidelines we did put out, mindful when we put them out, that guidelines are evolving. It's an iterative process, continue to evolve on the basis of this disease, on the basis of external reality and pressures. Again, mindful of so many of the variants, so many different strains, and mindful that we have a lot of work to do on vaccinations as well, and the impact that could have ultimately in terms of our success or failure, and also mindful that we're not an island. Other states are way behind in vaccinations, other countries as well, and so all those conditions could precipitate additional considerations, augmentations, and so that's, I think, what's important to communicate. But beyond that, the blueprint as we know it, the color coding, tiers as we know it, will be removed. And for average citizens, for the public, people like myself that want to go about doing business, that means you're not compelled by the rules that persist or have persisted since March, roughly, of last year.
So will you be lifting your pandemic emergency on June 15th?
The emergency remains in effect after June 15th.
What's the reason for that?
Because we're still in a state of emergency. This disease has not been extinguished. It's not vanished. It's not taking the summer months off. For all of the reasons I just enunciated, that's why we are not lifting the state of emergency here in the state.
This is Taryn Luna with the LA Times. Governor, your critics look at your record spending, stimulus checks, and this vaccine lottery and say you're pandering to voters because of the recall. Is that true?
Well, I'm really proud of the progress the state's made. You know, this is remarkable that 38.6 million vaccine doses have been administered in the state of California. As I noted a moment ago, it's 15.4 million more than the next state. We're proud of the work to get 70+% of Californians 18 and over vaccinated. Mindful still the work we have to do, particularly the Black and Latino communities, mindful of the work we have to do geographically, which was highlighted here today. Also very proud of the fact, and you saw the new jobs numbers that came out, 559,000 new jobs in the latest jobs report nationally, that on the basis of what we've experienced the last 3 months, 41% of America's jobs came out of the state of California in February, 38% of America's jobs came out of the state of California just last month. As a consequence of the economic recovery, economic growth, as a consequence of that and the incredible resilience of 40 million Californians and risk takers and entrepreneurs, California is enjoying the largest budget surplus in recorded history. Benefit of that is we're able to do a lot of things that in the past we weren't able to do, to build up our reserves, our rainy day funds, to pay down pension obligations at historic levels, to commit to making investments that pay huge dividends, TK for all being one of them, investments in mental health, investments in homelessness in particular at historic levels. I think those are wise investments under the circumstances, and I frame a response on the basis of how it should be framed. We've run a health-first approach. That's why our economy contracted less significantly in the last year than states like Florida, states like Texas, and our health outcomes, among the better health outcomes for large states in America. So a health-first approach allows the economy to reopen with more certainty, and it's elevated the expectations through June 15th that we don't have to look back, mindful again that some modifications may need to be in order on the basis of changing conditions. So historic is certainly the word. Historic investments, historic reserves, historic one-time investments, balanced budgets here in the state of California, and addressing some of these pre-pandemic issues like homelessness, affordability across the spectrum, and of course, issues related to public health and public education. As it relates to the issues of incentives, I'm very proud of the work that President Biden has done, highlighting this month around a race to independence, as Dr. Pan said, working to July 4th to get 70% of Americans vaccinated. We're a month ahead of the president's schedule, proud of that. But incentives are part of his package, part of his supports. We had an all-hands call with governors all across the country, and governors were comparing and contrasting some of their incentive programs. You see some states that are actually incentivizing vaccinations with guns. Some states are incentivizing vaccines with shots of beer and other alcohol. Folks are taking different approaches, Republican states, or at least Republican-run states, Democratic-run states. So we had a wonderful conversation with those governors, comparing and contrasting those best practices, parks, playground incentives, all kinds of incentives. Of course, a number of states, many states have done incentives along the lines that we're proposing today. And we're very proud of that example. And we thought we'd give it a try here in the state of California, aided by the support of the president, not just rhetorically, but also financially, and some of the stimulus dollars that will be made available to advance these programs.
Would you be making the same spending decisions if you were not facing a recall?
Every single decision I've made is consistent with the work I've done for decades and what I campaigned on. I campaigned on making historic investments in homelessness. We've been able to say that every year I've been in office, but nothing like this year. I campaigned to address the issue of housing and housing affordability, and we're making investments in that space at significant levels this year. Early childhood education has been a mantra of mine, focused mine for decades, and that's consistent, the budget priorities. Across the spectrum, the answer is absolutely yes. This year puts a smile on my face because so many things that I hope to accomplish, maybe the end of a term or 2 terms, we're able to fast forward, and that's because of the incredible work of 40 million Californians and the incredible economic recovery that the state is enjoying.
Last 2 questions.
Hi, Governor. This is Angela Hart with Kaiser Health News. Thank you for taking our questions. Experts I'm speaking with say that these incentive programs are a great way to reach the masses, but there remains a very large concerns about safety and efficacy among some of the people who are concerned about getting the vaccine. And some of the people I'm speaking with say, these giveaways are kind of a gimmick, and what they really want is their questions answered. They really want bread and butter public health, people responding to them, people knocking on their doors, and many people are not getting the message. The messaging that California is doing isn't reaching them. So I guess I wonder, is there other efforts beyond these big money giveaways to really reach some of the difficult, hesitant people?
Well, the answer is, of course, and we've been highlighting those almost on a daily basis over the course of the last number of months. And we've been significantly increasing those efforts, as you may know well, with partnerships with community-based organizations, in-language outreach, more pop-up sites, more walk-up sites, no reservations required, more strategies with trusted messengers and influencers, more efforts to work on paid media as well as earned media with influencers. Our team has been deployed incredible partnerships with Senator Pan and his office and other legislative leaders to advance those causes, tens of millions of dollars of investments, digital billboards, strategies to work with synagogues, churches, incredible partnerships with churches all up and down the state of California, working with farm workers, working with the Biden administration. We had Jill Biden out, for example, and Kamala Harris out, working to partner with the state of California on novel approaches. Jeff Sines, who runs the task force sharing best practices, which we've engaged and incorporated into our strategies. We as well announced some specific strategies around what we refer to as GOTV, Get Out the Vax, which was an initiative that has been paying great dividends. It's about boots on the ground. It's about people quite literally not walking to people's doors, but walking the streets volunteers. I was down in LA the other day in Chinatown, saw a group of young kids. They were quite literally just saying hello to people on the streets, encouraging them to get vaccinated in a local clinic, just to drop right in. It's exactly the kind of efforts we want to see more of all across the state, and we've been significantly increasing investments in that space, including massive phone breaking operations where we are doing precisely as some suggest, and that is answering those questions, those stubborn questions that people have, those remaining questions about the safety and the efficacy of our vaccine efforts.
Thank you. In this area on public health messaging, especially at a critical juncture in the pandemic with vaccine hesitancy, this is one of the areas that local public health departments say they're really hamstrung and really doing effectively, in part because of the long-term underfunding of public health in California. So my question for you is, the legislative leadership in the Senate and the Assembly have adopted in their budget negotiations that are going to be coming to your desk an annual ongoing investment of $200 million a year for public health infrastructure, as well as $115 million for racial health equity investments. Do you support the $200 million for local public health infrastructure, Governor, in the budget, and do you support the $115 million for racial health equity?
We're in the process of negotiating the budget with the Senate and Assembly leaders. We're very proud of our partnership. This has been a historic year of advancing our collective goals and values in real time. We've been making historic investments. We made investments early in the budget process, almost unprecedented, at least to my knowledge, unprecedented in modern history. Those partnerships advancing to address real vexing issues in the state, not least of which getting stimulus dollars into people's pockets, providing relief for rent, as well as utility burdens, water included, as well as supporting small businesses up and down the state. Those early actions have been incredible, and they're demonstrable in terms of those partnerships. The deal that was announced between the two houses is consistent with what we've seen in the past between two houses, and we're very grateful for their efforts and very, very pleased with the vast majority of the recommendations in terms of the budget we proposed and where we find common ground. As it relates to some of the remaining issues, billions and billions of additional dollars are being invested, billions, not hundreds of millions, billions, into public health. I've not been shy in terms of my support to advance the cause of health care, regardless of your immigration status, ability to pay, expanding, deepening subsidies in the middle class, and doing more to revitalize the Affordable Care Act than perhaps any other state in this country. Accordingly, we're doing once-in-a-generation reform of our Medi-Cal system, referred to as CalAIM, hundreds and hundreds of millions of dollars. Yesterday made announcements of $5.2 billion focusing on care and homes, focusing on our care economy more broadly, billions of dollars. So as it relates to the specifics, around a few $100 million, which is incredibly important as a former local health leader in the context of my role as former mayor of a county with a public health hospital. I'm very mindful of that work at the local level, and will be very mindful in our negotiations with the legislature around their recommendation to augment that support in this budget as well. And we look forward to working through those issues as we are in real time today, yesterday, throughout this weekend, and hopefully land on an announcement, a three-party agreement early next week.
Governor Rachel Wolf, CBS 13. I do have a question about this process here today. So
we welcome you and that opportunity.
So of the 200 that were chosen, the numeric indicators, and then we're paring it down from there. So it's always going to be from the original 200 that are chosen today. Is that correct in this entire process?
In this, well, it was 2.1 million people that were eligible today, and they randomly selected 200 that were brought here. And 50 that were put into this machine. We pulled 15 numbers out. Just imagine if everybody's ineligible for some reason, then we have two tiers. The 35 balls that were in here would be the first tier, and then we have a second tier, the 150 remaining that we would go through. Automatically, by the way, everybody that didn't win today, including all those behind me, are entered into next Friday's drawing, and all, of course, still that not winning will be eligible on the big draw. Those 10 individuals, $1.5 million each on June 15th, but only those that have gotten vaccinated. And that's why it's so important to remind people that if you want to participate and have this opportunity, then you got to get at least one dose, and we encourage you to do that as early as this afternoon. And as late as tomorrow and through June 15th, though the care system probably requires June 14th for those vaccinations to get into the system.
Last question in regards to the emergency declaration that you said is going to extend beyond June 15th. What is going to be done for, I understand that's going to provide money, put money in people's pockets that need it, but what is going to be done to bring people back to work and to incentivize employment and hiring in certain sectors that really need it? Is it going to be some sort of a tax abatement? Is it going to be some sort of housing? Because housing is a huge issue in bringing people in and getting people back to work, because there's going to be a lot of people that want to go out and enjoy things, but they may not have the employees to service all those people.
Yeah, look, I mean, with 38% of America's jobs were created in the state of California, so people are going back to work at historic numbers. We're seeing GDP rates like which we haven't seen in at least modern times. So California is starting to recover profoundly, and people are going back to work in very significant numbers. It'll be very interesting in the next few weeks when we tend to lag a few weeks when the nation comes out with their federal numbers, and then we'll announce the state numbers. But on the basis of the 41+% a few months ago, the 38 just last month of America's jobs being created, we're seeing people come back to work. But we're mindful they need childcare. We're mindful they need confidence that this pandemic is substantially under control. We're mindful that they need supports because of the anxiety, as you suggest, around housing. And I want to remind people that have been directly impacted by this pandemic are eligible. What we hope will be, when we work through the final week with the legislature, what we hope will be 100% of the rent that is due can be covered by the state through the generous spirit of the Biden administration. 100% of your rent going back to last year can be taken care of, as well as your utility and your water bills. So all those things are factors. And we're looking forward to seeing these numbers continue to grow. I'll just close with this. As it relates to some states that are eliminating unemployment insurance, I think that's politics, not economics. And I don't say that lightly. I say that on the basis of deep analytics. And I'm mindful that politics, not surprisingly, is aligned to 25 Republican-led states, no Democratic-led states, to consider the same. We will not put aside billions and billions of dollars of money that can be invested in our economy to help support our economic recovery and decrease demand as a consequence, which will only hurt our economic recovery. California will stay the course with those supplemental unemployment insurance benefits. They expire, as you know, just in a few months anyway. I see a lot of politics behind that, not a lot of economics.
Hi, Governor. Ashley Zavala with Nexstar Media Group. I am the last question, I understand. But so just to be clear on the Cal OSHA decision, are those in effect immediately? And on that note, I mean, what do you say to workers who are so confused because the administration has been promoting June 15th as this big, reopening date and restrictionless state of California, or not entirely, but for the most part, and now they're being told that they have to wear these masks potentially
if they're
to be
unvaccinated.
Yeah, if they're unvaccinated.
So we're working through those. I mean, look, this is the sausage making process, and what occurred last night, and we're going through. We've already had a series of conversations earlier this morning about people's feelings about what happened last night. And as you know, it was quite an intense conversation. I think it's healthy that the governor is not dictating and mandating the terms of those discussions in advance. We've certainly influenced broader conversations, and we hope to influence the conversations going forward, mindful, though, of the integrity of those decisions in that process, mindful that this disease is not 100% behind us. So what I'm saying as clearly as I possibly can on the basis of the previous answer and this answer is we are in an iterative process of engagement. We're almost 2 weeks out, a little less, of the June 15th, and we hope to be letting folks know more about our next steps very shortly. But we put out some very detailed guidelines across the spectrum, and I hope people will be pleased to see June 15th come and the reality of not having this blueprint mandating across 58 counties, the modifications of many of these businesses. But face coverings remain an important part of our arsenal to continue to mitigate the spread of this disease. And I just think that's important. And I know that a lot of employers support that, not just employees. I don't think that on the basis of my conversations. I know that. But there's still a lot of open-ended questions on the basis of what occurred last night. And we'll try to get those answered in the next days and certainly within the next few weeks. With that, I'm grateful for this opportunity to share and highlight our vaccination efforts. I'm very grateful to the California Legislature and Speaker Rendon and Tony Atkins for their incredible support and leadership, to the budget chairs, Skinner and Ting, for their advocacy and support, and to chairs of the Health Committee, Senator Pan, obviously, and his incredible leadership in this space for decades, but also Senator Wood and his leadership and support. We hope these incentives enliven people, get them to consider the opportunity to get vaccinated. We hope to share with you those that wish to be made public in the next days, and we look forward to, and Dr. Pan, can you grab that check? We look forward to handing these checks out very, very soon, and inviting those that wish to be made public to these check ceremonies. $50,000, 15 people, $750,000 given out today in California.